video, we'd like to discuss, does fertility truly decline with age? So, fertility is the process of getting pregnant and also avoiding any potential miscarriage and infertility. So, miscarriage, as we define here at Antai Hospital, is a pregnancy loss during the first trimester, second trimester, or third trimester. This can happen at any time during gestation. And an infertility is the process of being unable to get pregnant. So there is no formation of any pregnancy. So the entire process has never even begun. Whereas in miscarriage, the process has begun. So we do hear many doctors and experts, and also whether it's on radio or TV, it's very common that we hear that fertility of women declines with age. That's why you need to get pregnant as soon as possible. Well, this is in fact true. However, there is some falsehood in it as well, and let's discuss it along together. So it is true that your egg cells are of higher quality during your early ages, which is why your most fertile period is actually in your 20s and in your 30s. This is where your egg cells are of the highest quality, and your offspring, if you do get pregnant at a younger age, your offspring is very likely very healthy and has no complications, no deficiencies, no defects, which is why we recommend our women to actually get pregnant at an early age. However, fertility doesn't decline even if you get married in the age of 40 or 45. You can still get pregnant. However, there is a risk of potential pregnancy loss because your egg cells have declined in quality. This can be determined by the lifestyle that you've led throughout these 20 years. This can be manipulated. We are led to believe that fertility declines in our 30s, in our 40s, and we are unable to have pregnancies because we have a higher risk of chromosomal abnormalities or miscarriages in our later years. But this is actually due to poor lifestyle and poor diet that you have been following over the years. And then another thing that we want to mention is that it is possible that you do have an underlying cause that has been chronic and untreated for a long time. So these doctors, they don't really go recommend you for diagnosis to treat the underlying cause. They just directly refer you to IVF, where you do witness repeated failures, and you do believe that, oh, maybe I'm too old to get pregnant. We here at Antai Hospital, we've seen many couples at the age of 30s, 40s, even in their 50s, able to get healthy pregnancies where their children are completely healthy. So although your egg cells do decline in quality over the years, it doesn't affect the ability to get pregnant. If you do experience pregnancy losses in your 30s or 40s and you believe it's due to your age, it's actually not due to your age. It's actually due to certain underlying factors within your reproductive system. Some disease that can be prevented, can be treated. Very few people carry rare genetic diseases where their pregnancies always end in miscarriages. These people only comprise of less than 5%. If you lead a healthy lifestyle, if you avoid excessive alcohol, if you avoid smoking excessively, and then if you have an active lifestyle, and then also have a healthy diet, there is no reason for you to be unable to get pregnant in your 30s, in your 40s, even in your 50s. The only factor here is that your egg cells have declined in quality slightly. You can even maintain them if you lead a healthy, high-quality life, active, high-quality life. And then another thing that declines is the number of egg cells that you have. So if you do see that you're experiencing repeated miscarriages, it is actually not due to your age as per se, it's actually due to an underlying cause. For example, you may have developed a recent uterine fibroid, which is very common to have in the age of 40s and 50s. All you need to do is get yourself diagnosed and have it removed. Pregnancy can be had. Another thing is that you may develop some tubal blockage, some fluid accumulation, some pelvic inflammation, certain diseases that only needs to be diagnosed. And not every doctor can diagnose this, but what they will do is to recommend you to go for IVF, which will end in failure. So Antai Hospital always recommends patients to go for thorough diagnosis, and we believe that women can get pregnant at any age that they want, as long as menopause has not been reached. There's nothing stopping you from getting pregnant and having healthy pregnancy. We've seen that years in practice. We've seen many women at an advanced age have a healthy pregnancy, and if they do suffer some miscarriage, it can be diagnosed and prevented at Antai Hospital. So don't let age stop you, but do first receive the proper diagnosis that you need. Figure out if there's any underlying cause, and then you do need to have a healthy lifestyle that you need to be consistent at, and then you can achieve this great result of having a pregnancy even in your 30s and 40s. So get in touch via the website if you'd like to find out more information, and also set up consultations so that we can help you achieve your pregnancy goals.